kind of humming that's going on in my head.
Oh dear.
And which is quite apt, as today we're talking about Botox for migraines. Now, this is something, Botox, when we first heard about it, was, it'll take away the lines and the wrinkles, it'll do this and it'll do that. And then the statement came out, well, it's very good for getting rid of headaches, and then the physicians and the neurologists said, no, there's nothing proven in that field. But this is not necessarily true, is it?
This is one of these things where the circle turns the complete circle. In 1992, I suppose, when Botox was originally used for blepharospasm, which is a psychological tic where people keep going into a situation with their eyes where they sort of have a tic, where it sort of flickers all the time, and this is very, very distressing. Botox was one of the first FDA approvals for blepharospasm. One of the ophthalmic surgeons, who's a friend of mine, Jean Carruthers in Vancouver in Canada, noticed that people were coming in saying to her, hey, my wrinkles are gone. So she handed this over to Alistair, her husband, who's a dermatologist, who produced a Sentinel paper in 92, and suddenly we had this revolution of Botox. Now, I picked up Botox probably first around 1997 in Australia, and certainly doing a lot of Botox per week, I noticed then the other end, it coming back into the medical world, the people are saying to me, listen, my migraines are disappearing. I fought a bit of a battle, I must say, within sort of my colleagues over the sort of early part of the new century, and we had letters going back and forward in the Irish Medical Times for a period of 2 or 3 years, and eventually in 2007, the Irish Migraine Association invited me to Ennis to give a talk on this, and I sat down because of a background in molecular biochemistry as well to try and work out the neurotransmitters, the pathway, just to put a bit of beef around what we were finding. And the lecture was well appreciated, and certainly I put it on YouTube, and a lot of neurologists all the way from sort of South America to Washington in the United States came and said, I think you're onto something here. Can we use your lecture for this and that? But it's interesting, yes, but in the last month now, the Medicines Regulatory Authority in the United Kingdom and the equivalent in the United States have turned around and said, yes, Botox is an effective cure for chronic migraines. So the first thing you ask yourself is, what are chronic migraines? So chronic migraines are normally defined by somebody who has a migraine headache for at least 15 days per month, for at least 3 months continual, or else 8 days per month where you get this migraine without aura, and that you have to use, sort of continuing medication. Now, it's a bit like a lot of things in medicine, because it's coming in the back end, these are the people who are the chronic sufferers. These are people who almost nothing else works in. So in some ways, I think it's fair to say that my colleagues have been a bit slow on the pickup of this. The interesting thing about it is that the injection points are practically the same as they are cosmetically.
Right.
So at worst, all that can happen is your wrinkles will disappear. Now, we're not saying that it'll take away migraines in everybody, but there's absolutely no doubt there is a subset that it takes them away continually, including 2 of my staff. And there is, in something like 80% of people, a reduction in severity or the amount of medication that is used. So from that point of view, in the United Kingdom, they ran a series of trials recently of 1,300 people. And we're talking about a condition that there's 700,000 sufferers of chronic migraine in the UK. And I suppose if we scale back the figures, that would leave us 40,000 in Ireland. People that, yourself, have to go to dark rooms, end up sort of nausea and vomiting. Medication, you can throw it at them and it does
nothing.
Well, nothing.
In some cases, it might just tip. It might just dull the pain.
Sure. Well, I suppose I see the heavy end of it, because people will come to me and say the medicine doesn't work. So I suppose if the medicine was working, they wouldn't be coming to me.
Exactly.
But Botox doesn't work for everybody either. But we never said that it did. We always had said, have a look at this. Anecdotal evidence would suggest that it is working in Botox. Botox is working for migraines.
Yeah.
And I think that has been clinically proven now.
Now, when you say it's a cure for migraines, is it a cure or a continuing treatment?
Well, there's no doubt about it that Botox, as you know, wears off after a period of 4 to 6 months. So as soon as it wears off, the migraines come back again. So we know there is some stimuli either within the sort of complex of the frown muscles, which are the corrugator in the front, that trigger it. We know it runs through the trigeminal nerve, but the pathways in terms of the neurotransmitters haven't been properly worked out yet. I mean, we know exactly the way it works in wrinkles. It's blocking acetylcholine, so that it's a bit like a car engine turning. The gearbox disengaged in the clutch, so the back wheels can't turn around. Yeah. It's the same thing in terms of wrinkles. Your brain sends a signal for your muscle to move, but the Botox is a bit like the gearbox. It disengages the signal, so the muscle can't move, so all the other pathways are kept intact. Right. Now, we know that in Botox for migraines, it's a bit more complicated than this. There's at least 3 or 4 neurotransmitters involved, but I suppose the fact that we don't necessarily know exactly the way that it works because we haven't spent enough time looking at this from the point of view that this is the way that medicine develops. You know, the way that you talk about depression. The reason that we discovered the pathways is that one of our blood pressure drugs, Alpha, when it was given, caused depression. So we're able to work out back to front what happened. It was the same thing with sort of Botox and wrinkles. We were able to work back to front because it disappeared for another reason. So you'll probably see now a lot of research going into working out the neurotransmitters. But the ordinary patient in the street, it doesn't matter whether it's CAMP, GTP, acetylcholine, ACH, ADPAs, you know, they don't matter. What they want to know is, give me a shot and as my headache goes, that's all I want to know.
Just want to get rid of the headache at the end of the day, yeah?
Absolutely.
Well, I mean, it's something that I'd say there's going to be an awful lot more study done on and a lot more talks about. But I mean, you know, for me personally, I've had a headache since the day I was born, to be honest with you. And every day this week, and it's quite bizarre, every morning this week at about 3 minutes past 3 on my alarm clock, I've woken up and I feel as if there is it feels like a drill going off in my head, and it's actually the pain in my head that actually woke me up. So which was quite bizarre because I'm like, where is this coming from?
People really underestimate the power of migraines. If you look at the stats, it's more common than rheumatoid arthritis. It's more common, I believe, even than asthma in some societies and situations. I looked at some American sort of figures. But the fantastic thing now is, I suppose, it's coming in out of the cold. It's got sort of, you know, medical peer respect that this is an accepted I suppose pharmacological, you know, treatment. We got to really respect Botox.